Okay, my seat is safe. I'm wearing PPE. I have one patient. It's an NOI of chest pain. I'm gonna call ALS for backup, and I'm gonna rule out a spine injury because it doesn't look like she's fallen. The patient looks like an 18-year-old female struggling with chest pain. Hi, my name is Anya, and I'm an EMT. Why'd you call 911 today?
Because I have chest pain.
Okay. Do you know where you are?
Yes, I'm at my home in Charleston.
Okay, and do you know what day it is?
It's Monday.
Great. So the patient looks alert and oriented. Can I give you a quick exam?
Sure, yeah.
Okay, the patient looks to be maintaining her own airway, but I'm gonna look to see if there's any obstructions. Can you open your mouth and say ah? The airway is open and maintained. Now I'm gonna assess your breathing. Do you mind if I touch your chest?
Sure.
The patient has equal chest res and fall. And I'm just gonna listen to your breath sounds.
Okay.
Breath sounds are clear and bilateral. Okay, now I'm just going to, I'm gonna check your circulation. So can I feel both of your wrists?
Mm-hmm.
Thank you. Pulses are strong and regular. Can I feel your forehead?
Yes.
And her skin is pink, warm, and dry. And have you had any blood in your urine, vomit, or stool?
No.
Okay. So based on my initial assessment, I'm going to determine this patient high priority. So I'm going to update ALS with this information, and I'm going to now ask her a few questions. Is that okay?
Yeah.
Okay. Do you have any other signs or symptoms?
No.
Just your chest pain?
Yeah.
Okay. Do you have any allergies?
No, just to bee stings.
Okay. Do you take any medications?
I'm on birth control.
You're on birth control. Okay. Do you have any important past medical history?
No.
No. Okay. What's the last thing you ate today or drank?
I had a BLT for dinner.
Yummy.
And lemonade.
Okay. And what were you doing before your chest pain started?
I was just reading a book.
Okay. And did the onset just randomly happen when you were reading? Nothing? Okay.
Yeah.
How would you describe the pain in your own words?
It's sharp and kind of all over the right side.
Okay. Does anything make it worse or better?
I mean, it hurts more when I breathe, but it's consistent.
Okay. Does the pain stay in your chest or does it move anywhere in your body?
It stays in my chest.
Okay. How would you rate the pain on a scale of 1 to 10?
A 4.
A 4. 10 being the worst, so it's only a 4?
Oh, okay, a 6.
Okay. And would you say the pain comes and goes, or does it stay constant?
It stays constant. It's worse when I breathe, but it doesn't go away.
Okay, great. Now can I take some vitals?
Yes.
Perfect. So, okay, I'm actually going to start with your... Can you hold your phone? I'm going to start with your pulse. Okay, so can I just feel your wrist again? Pulse is 78, and now can I put my hand on your chest?
Mm-hmm.
Thank you. Okay, and respirations are 20. Oh, and her pulse was strong and regular, and her respirations are unlabored. Okay, and now I'm going to take your BP. Is that okay?
Mm-hmm.
Her BP was 128/82, and I'm just gonna feel her skin again. Is that okay? And her skin is still pink, warm, and dry. At this time, I would update ALS again and continue to determine that she is high priority, and I would reassess her vitals every 5 minutes. And I also might give her 324 milligrams of aspirin to help because I've determined that this is a cardiovascular emergency. And I would take her into the ambulance now into the hospital.